Hello guys, good evening. I hope you're all well and good. Okay, we'll start with why hydroxycobalamin is used for cyanide poisoning. So here the question is, we have two important statements to be explained. One is regarding hydroxycobalamin, the second one is regarding cyanide poisoning. Before that, we have to know what exactly is a cyanide poisoning and which patients are more prone to land up in cyanide poisoning. We have to understand that. See, cyanide poisoning, mostly patients, they might land up in accidental exposure to cyanide, which might be because of some items like they might take it up via per oral route, or they might land up in inhalation of cyanide poisoning. Either there might be per oral intake of cyanide, or there might be inhalational intake of cyanide. But out of this, which do you think is going to be more severe? The inhalational one will be more severe as compared to the per oral one. So cyanide inhalation produces more severe or more early adverse effects as compared to per oral. It will take a lot of time for the symptoms to be started. The next point is regarding which patients are more prone to land up in inhalational exposure. That's primarily patients who are exposed to smoke. For example, patients got stranded in an area where there is a fire breakout, and the furnitures are there which contains polyurethane. Because of that, whenever the fumes the patients are inhaling, they might land up in cyanide poisoning. Or patients who are landing up in continuous SNP, sodium nitroprusside, given via IV route. Continuous IV route, patients suffering from renal failure, and when sodium nitroprusside is administered for a longer duration of time, patients themselves might land up in cyanide poisoning. So the first take-home point is, for cyanide poisoning, previously we've had around multiple different drugs, like a combination of sodium nitrite, combination of sodium thiosulfate. We had cobalt, but currently the treatment of choice for cyanide poisoning would be hydroxycobalamin. How it is going to get treated, buddy? First of all, please understand that this hydroxycobalamin, this is an important like flowchart or like an equation which we are going to be writing up. Hydroxycobalamin will bind with cyanide. This combination will tend to produce cyanocobalamin. This combination will tend to produce cyanocobalamin, which in turn will be excreted out via kidney. So easily excreted out via kidney, and that is why this hydroxycobalamin serves as a simple template for the treatment of cyanide poisoning. Previously, we had sodium nitrite, sodium thiosulfate combination, but it has got lots of negative issues because patients who are getting co-exposed to carbon monoxide. For example, patients who are suffering from cyanide poisoning due to inhalation of fumes which contain cyanide, most commonly will be also suffering from co-poisoning with carbon monoxide. Carbon monoxide poisoning giving sodium nitrite is absolutely contraindicated, so we're not going to be doing that. Is that clear? Now, this is the first statement, guys. This is the treatment of choice. We can also administer sodium thiosulfate. We can also administer sodium thiosulfate in combination with cyanide. Again, whenever the sodium thiosulfate will binds with cyanide, this will produce thiocyanate. Thiocyanate, which is again excreted out via kidney. So what we do is we give a combination of two drugs. The first one is hydroxycobalamin given via IV route, and we administer sodium thiosulfate in a separate IV. It can be administered simultaneously along with hydroxycobalamin administration. So when you do that, the effect is going to get enhanced because it has got a very delayed response, sodium thiocyanate. So the later adverse effects can be prevented from this occurrence. But before that, now we have a famous story, but I don't know if you know that or not. We had around a 23-year-old medical student. That medical student had got a puppy, and suddenly the dog ate something, and because of it, the dog suddenly collapsed. And this medical student, who is 23-year-old, tried to revive that dog. He did CPR and he did mouth-to-mouth respiration, and following which the dog revived back. So he was happy, but he was under a query like why the dog suddenly fainted. But after like a few minutes of time, he started landing up in dizziness. He started landing up in racing heart. Palpitation was there. dizziness and palpitation. And he suddenly felt very much giddy. He was about to fall. He got admitted. And when he went to the hospital and was taken to the hospital, the doctor can clearly smell the presence of a bitter almond smell from the breath of the medical student. So this bitter almond smell is a characteristic feature of cyanide poisoning. So because what has actually happened is, from that bitter almond smell, he found out that this boy was suffering from cyanide poisoning, and the current treatment, the treatment which was there, was administered for the patient. This happened in 1983. It was published in Journal of American Medicine, some journal. It was published in 1983. See, here the point is, this dog has eaten something which the dog has landed up in cyanide poisoning. And this student, no, because when he was giving mouth-to-mouth respiration, the cyanide which the dog has taken started getting eliminated out via the lungs. So through the like, he was actually inhaling the cyanide via his normal respiration. So this patient landed up in quicker symptoms, which is giddiness. And now we know the reason why we say per oral cyanide compared to inhalational cyanide. Inhalational cyanide tend to produce very severe and more quicker progression of the diseases as compared to per oral forms of cyanide poisoning. With this, we'll complete today's Why Conundrum guide. We'll meet up in one more Why Conundrum in the next session. Bye-bye. Good night.